According to the National Council on Aging, in 2024, 60% of people enrolled in Part C plans had a $0 monthly premium. But how do the insurers make money if there's no monthly premium? Hi, I'm Larry Goist, owner of LMS Insurance Group, where we help seniors navigate the Medicare Maze. So in today's short video, I'm telling you guys all about Part C plans, and I'm going to go over three real basic topics. So number one, I'm going to tell you the basic structure of a Medicare Advantage or a Part C plan. Number two, I'm going to tell you what things you will pay for when you have Part C coverage. And then number three, I'm going to tell you exactly how Medicare Advantage insurers are able to make money if they're charging you no monthly premium. And that's all coming up next. Hey, before I dive in, don't forget to subscribe. Definitely like this channel if you find this information helpful. I really do appreciate you doing that. Okay, so let's start with the basic structure of a Part C Advantage plan. So Part C is also referred to as Medicare Advantage. So those words are interchangeable. And to have a Part C plan, you have to have Medicare A and B, and you have to live in a service area where these types of plans are offered. Now, the Medicare Part B premium is $185 in the year 2025, and this premium is withheld directly from your Social Security check. Now, if you're not on Social Security, then you get a quarterly bill for your Part B premium. So when you see advertisements about $0 plans, what they are saying is we charge $0 on top of Part B, but you are still paying your Part B premium when you have a Medicare Advantage plan. So when you enroll in a Part C plan, you are getting all of your Medicare benefits through a private insurer, and 60% of these plans charge no additional premium. So you'll just pay your Part B premium and nothing additional. Now, Medicare Advantage organizations have a contract with Medicare, and that contract spells out several important things. So, number one, every Medicare Advantage plan that's offered has to have at least 80-20 coverage. So, on average, your Medicare Advantage plan must pay 80% of your Medicare benefits. Okay, number two, Medicare Advantage organizations have to include in their plan what's called a maximum out-of-pocket. And a maximum out-of-pocket is the ceiling on what you can pay in a calendar year. So if they set your max out-of-pocket at $4,000, you know you can never spend more than $4,000 in a calendar year. And that's the big difference between a Medicare Advantage plan and original Medicare. If you had original Medicare and nothing else, there is no cap on what you could spend in a calendar year. Now, another part of that contract that the Part C company has with Medicare is that Medicare Advantage plans must cover what original Medicare would have covered. So they have to cover the same services that original Medicare would have covered. So now you have all your Medicare benefits under one roof. You have your Part A, B, and D, your drug benefit, all under one roof under a Medicare Advantage plan. And the Part C plans have to follow the rules that I just disclosed previously, as far as it has to be 80% coverage, it has to have a maximum out of pocket, and then in turn, you have to stay in that Medicare Advantage organization's network. So you're going to have a network of providers, and for you to get the lowest costs, you're going to have to stay in that plan's network of providers. Now, if you need more information on Medicare Advantage plans, I have several videos that go in depth on how these plans work, but this is just a real high-level overview so that I could then explain to you how they make money. Okay, so if you have zero monthly premium, what are you going to pay on these plans? Well, you're going to pay co-pays and co-insurance. So you're not going to pay monthly to have the plan, but when you use your plan, you're going to have a co-pay or co-insurance. Now, it's important to note that there are a lot of benefits that are offered for zero copay. So it's very common in 2025 for Medicare Advantage plans to offer zero copay on things like primary doctor visits, things like blood work, and they all have to cover preventative services at zero copay because original Medicare covers preventative services at zero copay. So you're not paying a monthly fee most of the time for Medicare Advantage, but you are paying copays and coinsurances up to that MOOP, that maximum out-of-pocket that I talked about in the earlier segment. So how do these Part C Advantage plans make money if you're not paying a monthly premium? So there are two basic ways that Part C plans make profit. So number one is they are receiving a fee from the government every month per member to manage their care. So let's use an example of a company ABC. And company ABC has 50,000 enrollees in their plan. Well, they're going to get a fee per month per member every month of the year. So if they had 50,000 people enrolled, the government is going to pay them a fee for each one of the people that they insure. So no matter how much you use your plan, they're getting a fee from the government to manage your care. Now that fee is different depending on where you live geographically and then also how healthy you are. So you are assigned a risk score, and the healthier you are, the lower your risk score is going to be. The more health problems you have, the higher your risk score is going to be. So each member on a Medicare Advantage plan has a risk score, and then the government is making payments to the Medicare Advantage organization every month based on your risk score. So somebody that is perfectly healthy, rarely goes to the doctor, that insurer might get a fee from $1,000 to $2,000 per month. Whereas somebody that's on dialysis or that's receiving cancer treatment, their risk score is going to be a lot higher. That Medicare Advantage organization might receive $8,000 to $10,000 per month for that member. Now those last numbers are just made up examples, okay? But that is exactly how it works. The sicker you are, the more the insurer is going to get paid per month. And the healthier you are, the less the insurer is going to get paid per month, because the government is expecting, or they're trying to anticipate, how much that insurer is going to have to pay out in claims for that particular member. Okay, now the second ways these Medicare Advantage companies make money is with their star ratings. So CMS gives each plan a star rating. And the star rating is supposed to be a measure of the quality of the plan. And the higher the star rating they receive, they get what's called bonus money. And according to the Kaiser Family Foundation, in 2023, the government paid out $454 billion to Medicare Advantage companies between the monthly payments and the bonus payments that they received. $454 billion. So to conclude, when you take a Part C Advantage plan, you are opting to get your Medicare benefits through a private insurer. That insurer has a contract with the government, and they must cover at least 80% of your claims. They also must cover the same services that original Medicare would have offered, and they have to put a maximum out-of-pocket on your plan, so you cannot just continue to be billed for healthcare services. Now, these companies are paid per member per month by the government, and the size of that payment is going to be based on your health, which they call a risk score, and then also how much bonus money that insurer was able to receive based on their star rating. So when you hear you can get a $0 Medicare Advantage plan, you absolutely can, because again, 60% of the plans offered are zero premium plans. But remember, you must continue to pay your Part B Medicare premium to enroll in one of these Part C plans. Guys, I hope this video was helpful. I'll talk to you next time. Larry Goist, LMS Insurance Group.